Ayurvedic professionals for the authentic, true, real Ayurveda practice, teaching and research to improve the community health. So, so we have Chatushpad or four pillars. Our first pillar, our first goal is to unite all the Ayurvedic physicians and practitioners for the advancement of authentic Ayurvedic medicine focused on the highest standards for healthcare, clinical care, training, research. So it's to bring all of us together. That's our one pillar. The second pillar is to collaborate, to coordinate, to partner with all other national and global organizations and allied organizations and institutions to spread the light, the wisdom, and the healing of authentic Ayurvedic medicine and the healing power. And our third pillar is to educate, and that's why we are all here on the Sambhasha, is to educate, to offer progressive and continuing education to AAP members and everyone in this area of authentic, true Ayurvedic clinical practice among, and also to help not just with the practice, also to help with the business aspects of it, because you may have all the wisdom, but sometimes we need the business skills. So we want to help with that, to bring business skills, techniques, marketing, financing, taxes, and legal aspects too. We have legal team on our members on our board to help people in educating with the legal aspects and business aspects. And our fourth and the most important pillar here is to empower all the Ayurvedic practitioners, honor the 8,000 plus hours of training all our BMS physicians have taken, the BMS, the MD, the PhD, the Ayurvedic graduates, and to further train them and certify them as Ayurvedic practitioners in this country. So welcome to all of you to this Sambhasha, and we are so glad to have our esteemed panel here to Dr. Vaidya Suhas Shetty, Vaidya Jayagopal Parla, and Vaidya Nimisha Patel, or a psychologist, and also to our own Vaidya Deepa Bhatt to take it from here and to moderate this discussion. Thank you, all of you. बहुत बहुत धन्यवाद. Thank you, all of you, for being here.
Thank you, Dr. Amit. Nice of you to give the brief introduction about AAP. I would like to once again welcome all of you for our Sambhasha series. As you all know, April is a month of raising awareness to the cause and cures of our modern day stress epidemic. This is why we have decided to choose this topic, harmony in healing, exploring the integrative approach to mental health, as a topic hosted by American Association of Ayurvedic Professionals, AAP. I would like to again formally welcome all our esteemed panelists, our president, vice president of AAP, and as well as all the board members. And we have people joined with different healthcare professionals, Ayurveda practitioners, students, and Ayurveda enthusiasts, both in Zoom, and we are on live in Facebook and YouTube channel. So for everybody, a warm welcome for our today's session.
Thank you.
I would like to say a few more words on AAP. As Amit already introduced about it, I would like to invite all of you to support AAP as a member, and also if you are interested in be a volunteer also, because we are all joined here to grow our community and collaborate for a bright and healthy future of Ayurveda in US. So let's start with a brief introduction of our panelists today. I would like to start the introduction with our esteemed panelist, Vaidya Jayagopal Parla ji. He's an Ayurveda practitioner. He has done a fellowship in integrative medicine, master's in acupuncture and oriental medicine. He's a certified yoga therapist and is an internationally known speaker, educator, and practitioner of Ayurveda with extensive clinical teaching and research experience. He is the founder and director of Atreya Ayurvedic Integrative Health Center at California and founder and vice president of Atreya Herbs. Faculty at Southern California University of Health Sciences, Mount Madonna College of Ayurveda, Kerala Ayurveda Academy, and Japan School of Ayurveda. A warm welcome to Vaidya Jayagopal Parla sir to our session today.
Thank you very much. Thanks for having me.
Thank you. Next, our next panelist is Dr. Suhas Kumar Shetty. He's an Ayurveda practitioner, academician, researcher, and administrator who is specialized in mental health research methodology with an experience of over 18 years. Currently, he is holding a post of principal and medical director at KLE Academy of Higher Education and Research, Belgavi. Formerly, he was a professor and head of the Department of Ayurveda Psychology and Psychiatry and dean at SDM College of Ayurveda, Hassan. He is also an adjunct faculty at Southern California University of Health Sciences, and he is an international invited speaker in various conferences and workshops across the globe. He is in editorial and review board of many scientific journals. He has to his credit 3 books and more than 72 scientific articles in various international peer-reviewed journals. He is a recipient of various academic awards like Contingent Grant Award from CCRS, Pratibha Puraskar Award, and to mention a few. He is an invited technical expert in various national and international policy documents and consultation meetings like WHO, CCIM, etc. He is specialized in mental health care consultation, clinical research, and workplace stress management workshops, etc. Welcome, Vaidya Suhas Shetty. And also a very happy birthday wishes from the entire ARP family to you.
Thank you. Thank you very much. It's really an honor to me part of this particular panel discussion. Thank you.
Thank you. Our next esteemed panelist is Nimisha Patel. Our own Nimisha Patel from our own city currently resides in Plano, but her journey into the field of mental health and nutrition began in Chicago, where she earned her undergraduate degree in nutrition and medical dietetics. She embarked on her path as a food and mood therapist, initially specializing in eating disorders. Over time, she expanded her expertise, becoming a licensed clinical social worker, providing psychotherapy as well as holistic nutrition therapy to adults grappling with anxiety, depression, and various eating disorders. Nimisha targets the emotional and nutritional roots of emotional eating. She employs a multifaceted approach, blending cognitive behavioral therapy, acceptance and commitment therapy, exposure and response prevention, and mindful eating techniques to equip her patients to manage their emotional eating struggles effectively. Recognizing complexity faced by South Asian community, Nimisha also offers support to individuals and families navigating issues stemming from cultural conflicts, gender roles, domestic violence, and the challenges of raising children and teens within different societal frameworks. Welcome, Nimisha Patel, again to our session today.
Thank you for the invitation.
And lastly, myself, I'm Vaidya Deepa Bhatt. I'm the secretary and treasurer at ARP. I'm a classically trained Vaidya specialized in Panchakarma, a registered yoga professional, and a classical Indian musician. I'll be moderating our session today. A few house rules before we start our session. We request all our viewers to be on mute throughout the discussion, and please put any questions in the chat. Another request we have is please do not discuss any personal medical information in the questions and the chat. And know that the information provided in the discussion today is just a general education purpose and it doesn't provide any medical advice nor substitute any medical advice. Please talk to your doctor or a healthcare professional before making any changes to your diet and lifestyle. Once again, I welcome everyone. Without further ado, we are going to start our session. with one more, description. Those who are new to our Sambhasha series, this will be a panel discussion. It won't be like just a presentation part of it. We're going to ask questions to all our esteemed panelists, and they will be giving us overview about what is their perspective as well as along with their experience and probably the latest research updates when needed. So let me begin with Vaidya Suhas ji. Can you please tell us about what is mental health according to Ayurveda and why is it important to talk about it openly in today's world? Please.
So, namaste everybody. We always talk about health, and as we know that health is defined as a complete state of physical, mental, and social well-being, not merely an absence of disease. So, though we give a lot of importance for all the components, like we say, physical health, mental health, and social health, but probably we do not give much importance for the mental health. The reasons could be many. The most important thing is about the perception of the problem, because it's very easy that suppose I have fever, cold, cough, no, I easily recognize that I have some physical issues and probably I try to contact my physicians or my consultant. But when it comes to the mental health, no, I really do not understand what is normal. And there are so much of cultural differences and so much of individual differences, so much of social stigma. So that's the reason why there is a lot of depth for awareness. And if you look into the WHO statistics, that the health seeking behavior, especially in relation with the mental health, is very less. Like it is said that more than 70 to 86% of people do not seek mental health help for the mental health issues, and which is a quite huge gap that we are trying to face. So when we talk about the health in Ayurveda, we very commonly describe to Shushruta Samhita's very famous quote saying that samadosha samagnishta samadhatu malakriyaha prasanna atmendriya vanha swastha ityabhidhiyate. So, but still, no, if you ask anyone or any of the common practicing physician, how do you define mental health? Still, it is not very clearly defined. Though we quote this as a very common quotation in terms of the defining the health. Because we have never been oriented towards how to approach towards the mental health until unless you are specialized in mental health. In general teaching, you are not oriented towards that. Similarly, if you look at how do you identify this or how do you define mental health in Ayurveda, I think the most important clue that you get from the chapter of Unmada. I think mental health has a very strong relationship with the basic concepts of maybe Nidana and Chikitsa mentioned in Unmada chapters, and there, especially, how do you identify a person being cured of a mental illness? So you get a quote, and almost the same quotation that Shushruta mentions, no, about samadosha samagnisha, same is there, but in the initial stage he talks more about the mental health issues, and then probably talks about the balance of the doshas. So you get a quote saying that it is prasadasya indriyarthanam buddhi atma manasa tatha dhatunam prakritistam vigata unmada lakshanam. So, whenever there is a wellness or sense of well-being of a mental faculty, especially the sense faculty, the intellectual faculties, the self, as well as mind, and the normalcy of dhatus. So that is where probably you consider that to be a sense of, or you call that to be the definition or the overall understanding of the mental health in Ayurveda. Thank you.
Very well said. Thank you. It is such a broad perspective that has been explained in our classical text. Again, I think this will be a nice platform once again to let people know how much we need to prioritize our mental health, like we do with small physical symptoms and illnesses. Thank you, Dr. Suhas. I would like to ask Nimisha Patel as well to tell us a little more about what is the description of mental health according to modern medicine?
Um, so, from my perspective, and I feel like I'm learning so much. First of all, I'm not very well versed in Ayurvedic medicine, so all of this is a learning experience for me to be able to pass on to the folks that I work with. But from my perspective as a registered dietitian, licensed clinical social worker, I'm looking at mental health in terms of our brain health, how our brain health is actually working. It's one of the systems in our body, and it's a system that needs to work together with the rest of the body. And often at times it's a system that tends to be minimized or neglected because of stigma. And so from my approach, I'm talking about mental health in terms of the brain, the biochemistry of fluids, fats, energy sources, nutrients that help enzymes and hormones and neurotransmitters to promote brain health and therefore promote mental health. So from my perspective, mental health is looking at all these different systems that are working inside of our body and how through our lifestyles, how do we support that mental health? The other aspect of that mental health that I work with, which is, I guess, more from a clinical social work perspective, is really how a person experiences and reacts to the people and the world around them. And this is during their life stages. Those experiences, how they interpret those experiences, how they react towards those experiences, whether they be positive experiences or negative experiences, is going to impact their mental health in the future. So it's the experiences that are coming from the outside into the body, but it's also about how the brain is functioning as a system together with the other systems in the body. And that's how I integrate it into my work.
Absolutely, absolutely. I love the way how the discussion is starting right now, because there is so much of integration that we can see here. With that, I would love to take the question to Dr. Jayagopalji. Could you please add what is your perception on how does Ayurveda view the mind and body connection, and why is it important for us for the mental wellness?
Thank you. So the point that I want to bring is all Ayurvedic practitioners as such, when we start off with this strong belief that mind and body are so integrally connected, inseparably connected. And when it comes to the mental health, that connection seems to be not very well established. And we get these small nuggets of information all over, like from diseases of mental, faculty, to somewhere in indigestion, ajirna, to even in case of grahani. There are some areas of these information not collected and gathered in one place. So the students get to learn about the mind-body connection when it comes to pathology in fragmented fashion. When it comes to swasthya, it is seen as collectively, yes, mind is required, a prasanna, sattva is required. But when it comes to disease, there is all this laid out information where the students and the faculty have to pick up this information and then cater it to. So even when we come as practitioners to the US or to even in India, we learn as we practice about the mental health. We learn. There is no set path because, of course, every individual is different, but there seems to be a constant struggle and learning happening at the same time at the part of each practitioner. So the information is taken from the Western perspective because there's a lot of research that is coming in, which is saying, okay, the gut is important, the skin biome is important, the various aspects. We now start weaving through these gems or nuggets that we have all over the Ayurvedic literature, and then we start connecting. Okay, this is what mind-body connection means in Ayurveda. So nevertheless, the connection of mind and body is so helpful in Ayurvedic practice that it's uh, giving new light to functional medicine, or even like the medicine that is now developing as like neuroendocrine or psychological or psychiatric medicine. All of that is taking part of this mind body connection. So to get your point here, every treatment here or elsewhere, in the US or elsewhere, should be a mind body based treatment. That's how people are looking into now, and there is no treatment that is complete without mind body connection.
Absolutely true. Thank you so much for putting that point and highlighting. Um, we kind of like understood what is mental health from both like the traditional point of view and modern medicine point of view. Now, I want all of you to take moment and tell your perspective about what does integrative mental health mean to you? Why is it important? And probably if you want to share a few experience uh, or any research developments that has happened in the integrative mental health area. I would like to start with Vaidya Suhasji. Please go ahead.
Yeah. See, basically, the integrative mental health talks about where probably you're getting the best of the different health system together to benefit the people. So ultimately, the beneficiary is the public or the community or the society, where you try to look. No, it is not just a system we are talking about, but try to get the best of each of the system. So very often when we talk about the integrative mental health system, like especially if we talk about my personal experiences, we are part of a medical university where we have the modern medicine, then the dental, pharmacy, physiotherapy, nursing, homeopathy, Ayurveda. So it's a multi faculty integrative healthcare university where we have 12 medical institutions under one campus. So we try to bring the best of each of the systems, and we have developed an integrative medicine the department also. And like very recently, from July 1st, we have also started the integrative psychiatry OPD also in our medical college, where probably the allopathic people are trying to send to us for the different help that we can give along with their existing medication. So it's all about giving the best of the systems to the best interest of the people or the public. Apart from we always talk about the integrative medicine where you're trying to integrate Ayurveda with the allopathy. But I also strongly believe that there could be a integrative medicine among the Ayush system, like from Ayurveda, Unani, Siddha. Also, we can have a strong integrative system apart from definitely adding to that. I've seen a lot of patients with psychotic disorders like schizophrenia, bipolar disorders, personality disorders, severe major depressive episodes, where no, we can definitely help with the integrative approach. I'll just give one example of schizophrenia. As you know, schizophrenia has two spectrum. We have the positive symptoms and the negative symptoms. The positive symptoms really respond very well for the modern medicine, like the antipsychotics, the typical or atypical antipsychotics really are very good in maybe addressing the hallucinations, delusions, etc. But whereas if you look at the negative symptoms like apathy, social withdrawal, or no, where they have this personality disorders, getting low mood, etc. In such conditions, Ayurveda and the yoga therapy really helps. So probably this could be a very good model that we are looking at in managing various types of disorders. Just two weeks back, we have published a very nice elaborative protocol called as the whole system protocol in major depressive disorders, where we are trying to integrate allopathy, Ayurveda, and the yoga practices in the management of like it's a randomized control trial where we had 30 patients in each of the group, and we have published in a very high quality index journal, which probably I'll share the link of this particular journal in the chat box. Thank you.
That would be wonderful. So much of clarity and so much of meaning for the integrative word towards achieving mental health and wellness. Thank you, Dr. Suhas. And Dr. Jayagopal, please, what are your thoughts on it?
Integrative medicine is picking up in as I practice in the US. There is a lot of emphasis being given to integrative practice, where, as earlier Dr. Suhas mentioned, it is all about patient-centric care, where different modalities come together to see what best works for the patient's recovery and well-being. In the recent times, the integrative medicine has taken a lot of systems, like traditional systems, including acupuncture, Ayurveda, yoga, and even naturopathic medicines. These have come into in mainstream attention because evidence is what they are looking at. So there is now a large body of evidence that has shown a integrative approach is the right way of giving patient care. It's not only from the from a practice point of view, but if you look at any of our clients who come to us, or if they go to an allopathic doctor, they have so much of knowledge about other modalities. Now the doctors are compelled to learn about what is this that my patient is doing. Why is this patient is taking this type of a supplement? So it is somewhat ego-teasing for all the practitioners to learn about other modalities. So it is coming from the grassroots, from the patients, but also it has become a much more reliable, evidence-based approach to the patient care. So that's where we see the integration. I work at a university where we have chiropractic, acupuncture, nutritional medicine, and then physician assistants simultaneously working with us. We have rotations of students who come in from the various systems to learn about how each system can look what best is there, what is lacking in our system, what can be complementing from the other system of medicine. So that is happening now, but it may evolve few years to get the best out of it. And that's because right now what is happening also is a little bit of pointing at each other. So, oh, you do that, you do this. So there is a little bit of that stigma where people are practitioners are not open to talk about what they really do, because they are thinking that, okay, it may not be scientific, it not be validated. So we have to come out of that and then see what evidence we can prove, and then document it, and then send it to the other healthcare practitioners in the profession.
Absolutely. Love it. And this is what we were all dreaming, and it is happening, like you said. And also, this kind of session will help people also to understand that it's okay to undergo integrated healthcare, because I see, like you mentioned, the stigma that afraidness, scariness is also there, that I don't think I can try another system of medicine when I'm going through a particular system of medicine, right? There could be any reactions or whatever the negative aspects. There are positive effects also, but at the same time, we need to be aware about the, you know, what to say. There can be drug reactions or anything could happen, and that awareness is also must for any individual who is opting for the healthcare system. And yeah, we are igniting that thought here. Nimisha, we would
Yeah,
like to hear what do you think about integrating.
absolutely. It's very important, and I want to support everything that both of the panelists have said. But I'm not going to repeat it because I completely agree with them. My personal experience, as I became a dietitian almost 30 years ago, what I learned is pretty much redundant right now. And simply because our professions evolve, our knowledge evolves, and it behooves us to make sure that we and our practice is evolving with it, right? I think I had read somewhere a while back that from the time that research comes out from clinical studies to the time that a medical professional is actually conveying that information to their patient is about 17 years, which I think is an extraordinary amount of time for somebody to not have information about their bodies and about their health, right? So when I became a dietitian and I started working in eating disorders, one of the reasons that I went into mental health was because there was such a big piece of mental health in treating people with eating disorders. And it was important for me as a dietitian to really be able to understand that and to be able to provide that level of integrative healthcare. As I progressed in my career, I also trained in functional medicine. So there's a saying in eating disorder treatment, well, it's not really about the food, it's about the underlying emotional issues. And I feel like in my evolution, I've come full circle in that, well, you know what? It is about the food because we have food and nutrition that nourishes our brain and that helps all the systems in our bodies to work, right? So, yes, there is definitely an important piece that addressing emotional issues, psychological issues, behavioral issues through traditional psychotherapeutic approaches, it's very, very important. But you're not going to be able to do that if you have a brain that hasn't been nourished, as what happens with somebody who has anorexia or bulimia or any of the other types of eating disorders. My patients that I work with a lot are individuals with binge eating, compulsive eating. And, about 20, 30 years ago, there are a lot of people who are on extreme amounts of antibiotics for various different reasons. They didn't mention probiotics at that time. And so now, when I'm working with adult patients who are maybe in their 40s, 50s, and 60s, who are having these gastrointestinal issues, and they're also binge eaters on top of that. So a lot of the foods that they're eating are processed foods, feeding a lot of the unhealthy bacteria in their digestive systems. Yet that doesn't get addressed in traditional eating disorder treatment. And so, again, I'm looking to learn and integrate that into my eating disorder treatment when I'm practicing as a nutrition professional. And what my esteemed colleagues are talking about here is another area that needs to be incorporated into eating disorder treatment too, because it's addressing the different ways that the body can receive information, be treated, um, and to help it heal itself. And that's what we're all looking for in the long term, right? It's really how do we help our patients make decisions so that they can be empowered and have the knowledge to heal their bodies, whether it be above the neck, mental health, or below the neck, physical health. So yes, I'm in full support. I mean, I think we're all, sharing the same message, and it's about encouraging our patients to see what are the different types of approaches that are out there that can really help them individually heal themselves.
Absolutely. Amazing. Amazing information. I can see how passionate you are all with what you are saying and what you are giving. This is giving us a much more comprehensive view, especially when it comes to mental health. We talked a little about now, like food and the importance of food. Let's come to a topic. What is the role of nutrition in mental health? I would like to ask Dr. Jayagopalji, how does Ayurveda approach diet recommendations for maintaining mental balance?
So I would like to take all of our audience here to a shloka, because no panel is complete without an Ayurvedic shloka. So pardon us, when it comes to Nimisha ji, she may not understand, but I'll give you the translation for it. It's from the 5th chapter of Charaka's textbook, which is Matra Shriti Adhyaya. He says, what is to be eaten on a daily basis. There is a shloka for all body types, and all year long there is a selection of few nutrients that or nutritional substances So it says, Shashtikan Shali Mudgamscha Sainda Vamalakevan Antarikshapaya Sapirjangala Maduchya Abhyaset. So this is a list that has been given. So which includes a rice that is grown in 60 days, then mung bean, then honey, ghee, rainwater, then lean meat. These are the things one should eat. That's what. So, what is the benefit of this? He says, "Tacha nityam prayunji." The one who eats this type of a diet on a regular basis, swastham yenanu vartate. So the life enhances. The swasthya means the mind, body, and the soul. They continue to live in this jivita. That means together in an amalgamation where they move through the liveliness or life as such. Ajatanam vikaranam. So the vyadi or diseases that are not generated. So it really goes back to the point that nowadays, the modern science, they have, really, they're obsessed with gut bacteria, I think. So there is this total, body of research that is piling up, and there's a lot of importance being given to what gut does to help with the swasthya enanu vartate. So continuing to help the person to live healthy long life. So now if we apply that, the whatever Charaka's list that has been given, we may terribly fail, because that diet is chosen for people who live in that specific part of the world. We cannot take that and then fix it. Like we have these blue zones, people who live longest and healthiest, and you can't peel out their diet and then put it into your diet as, okay, I want to do Okinawan diet, I want to do Sardinian diet, it is not going to work like that. It is to be chosen and selected by an individual. What works best for them is what we need to see in terms of their, biodiversity, in terms of their gut. If you look at, we have 1:9 ratio of body cells to gut bacteria. So we need to really, cater to their needs to be mentally healthy, because they signal our serotonin uptake, and how much of choline we are producing, etc. in the gut is done by what we eat. So we are entering into definitely a new paradigm in nutrition, where Ayurveda can really bring in a lot of depth of knowledge, and we as practitioners, we can bring this information to our patients by really catering. That's what I do when I sit with my patients. My prescription is this much, my diet is this much, where I give them a breakfast menu, lunch menu, and dinner menu that matches what their herb needs are and their health needs are.
Wonderful, wonderful. Mimisha, can you also please let us know how does nutrition plays a role in mental health?
Well, I think I mentioned before that, there are all these systems, right? And they're made up of hormones, enzymes, neurotransmitters, and all of those need to be produced somehow or another. And so in my practice, I'm seeing people who have different relationships with food and eating. And those different relationships with food and eating then determine the quality of the food that's going inside of their body. Their digestive tracts, how they're digesting their food, then determines the quality of nutrients that go from that food inside of the body, right? And so for me, when I think about nutrition, I think about the roles that nutrients have in each and every step of that way. Well, whether it be in digestive enzymes to help people digest the food, whether it be in producing serotonin, in a healthy gut microbiome, but also whether it be in supporting the enzymes that are responsible for developing neurotransmitters, which then promote brain health, that promote moods as well. So looking at nutrition, not just in terms of calories and how much weight is it going to, make somebody gain, but really looking at it from a functional perspective in, how does it support the various different systems that are going on in the body? Because the systems are all working together. They need to be able to work together. So so I'm talking about the building blocks like amino acids for neurotransmitters. It tends to be a challenge, certainly within certain communities where people have become vegan and vegetarian. And not to say that those are not, not good lifestyles. But when I'm working with people struggling with eating disorders, they're often using the vegan and the vegetarian lifestyle as a way of justifying their eating disorder behavior. And so that's where you have that, that overlap between nutrition and mental health. Um, and then when they're practicing their eating disorder behavior, that means that, the supply of amino acids or nutrients like zinc and magnesium and B6 going into the body, those nutrients are important in neurotransmitter production, that becomes compromised. So it's really, really important that we educate. And I know that with my patients, I'm educating them again about the functional role of nutrition and nutrients, besides just looking at calories and grams of fat, um, and looking at, how detrimental that's going to be to their weight, giving them more of an all-round, more broader picture, I would say.
Agree, totally agree. And can you also describe, I know you have worked on this gut and brain health a lot. What is the relationship between the imbalance in gut bacteria and mental health conditions such as depression and anxiety?
So when I was doing the workshops, I did a number of workshops that educated not just the community around me, the layperson community, but also educating mental health professionals because mental health professionals in their training, they're looking at various different types of psychotherapeutic approaches, they're looking at human behavior and development. But they were often overlooking, well, what else is going on in the body that impacts brain health and mental health. I believe it was Caltech a number of years back had discovered that there's 20 different species of bacteria that produce serotonin. And that's really important for brain health. We know that. But if a person is, for whatever reason, doesn't have a nutrient-dense diet, if they're practicing an eating disorder, or if they're very anxious and then they're by themselves, they're living by themselves, and they're not eating a varied diet, or if they're depressed and they have no motivation to eat, that all of that compromises the kind of nutrition that's coming in. We are also living in a world where there are food deserts. So there are people from low socioeconomic communities that do not have nutrient-dense foods available to them. And so the quality of the nutrition that's going inside of the body is compromised. And so if that quality is compromised, then the question is, how is that impacting brain health? If the digestion is an issue, then how is that affecting things like serotonin production? If those bacteria that are responsible for serotonin production are not operating or functioning properly, or maybe they're in a minority, maybe the unhealthy bacteria are in a majority there. These are all questions that are really important. If it leads to an inflammatory condition, so now if we have damage to the gut lining, that immediately it triggers off the immune system. So if we have a damaged gut lining, we're having protein particles maybe going through or food particles going through into the body. The immune system reacts. These are foreign bodies coming in. Who are they? And so the immune system, like an army, is going to be challenging. That's how we have inflammation. Whenever we hurt ourselves, we have redness and swelling around the injury site, and that's our immune system doing what it's normally supposed to do. Unfortunately, for many people, that immune system is constantly being activated, and that inflammatory signal is often going to the blood-brain barrier. And so we have people who are struggling with depression. But then when they're looking around them, they're looking at the foods around them that will alleviate, albeit very temporarily, they'll alleviate that depression. And so for a short period of time, they're feeling relief from that depression. For a short period of time, they're feeling relief from the anxiety. And so now we have more processed foods that are being introduced into the body. And it's the unhealthy bacteria that are feeding on those processed foods. And so we've kind of come full circle around in terms of the unhealthy bacteria being fed, growing in larger numbers, damaging the gut lining, and then again, continue to send that inflammatory signal back up to the brain. So that's my take on like what's going on between the gut and the brain. Similarly, there are people and children who've gone through adverse childhood experiences. They've carried that on to their adult years, and this often creates inflammation in the brain itself. And so now we have an inflammatory signal that's being sent down the vagus nerve to the intestines, to the digestive system. So if anybody remembers a time that they were super nervous about something, really, really anxious, think about where physiologically you've experienced it in your body. A lot of people that I meet with talk about feeling that butterfly feeling in the stomach, or they feel like they're having loose stools, or sometimes some people even say they're having diarrhea, just because of the circumstances that they're in. That's creating a lot of anxiety. And now that messaging is going down from the brain down to the gut.
Absolutely. Great points, Nimisha. Thank you for sharing that. Like Dr. Jayagopal is saying, people are obsessed with gut-brain axis, gut theory. Nowadays, everywhere, whatever you talk, the point comes down to that. Dr. Suhasji, how does Ayurveda connect digestive health, gut microbiome with brain and hormonal health and mental wellness? What is the interconnectedness to all of these things?
I really add on to what the other panelists have already said. I strongly believe that there's a strong relationship between the gut health or and the gut microbiome with the brain health. I think the future definitely will be about the nutritional psychiatry as well as the preventive psychiatry, with emphasis on the psychoneuroimmunology and psychoneuroendocrinology, where we are trying to integrate all these things at the clinical level. Even Ayurveda strongly believes in the maintenance of Agni. I think the concept of Agni, at both at the level of the Jatragni, Dhatu Agni, as well as the Bhutagni, is what it strongly believes. And it is said that most of the diseases, if we're able to probably, correct or just to promote the treatment of Agni, we'll be able to do a lot of corrections. That's the reason, though most of the patients come to us with psychiatric illnesses like depression, anxiety, bipolar disorders, schizophrenia, substance abuse, we generally try to correct the Agni for at least 3 to 5 days. The more focus will be on correcting their Agni internally as well as externally, giving them Dipana, Pachana, Chakradhara, Parisheka, Udvartana. So this will be the first line of treatment irrespective of the diseases. I think this is what is commonly seen. And there are four main categories of the treatment that we try to adopt in most of the conditions, which comprises of Ahara, Vihara, Achara, and Aushadhi, where Ahara refers to the diet and the dietary prescriptions. The Vihara refers to the lifestyle and other modification that need to be done. The Achara refers to various psychological measures that need to be taken. And of course, there are different types of the medicines. We are talking about Ityopashraya, Devapashraya, and Sattvaja Chikitsa. We are talking on the broad purview of the Aushadhi we are talking about. Especially, we get a lot of good description about the relationship between the diet and the mental health, especially from Bhagavad Gita, where it is said as Ahara Shuddho Sattva Shuddhi. And even the food is categorized into the Sattvic Ahara, Rajasic Ahara, and Tamasic Ahara. Probably these are very good leads, which can definitely help in probably giving a proper diet. And probably I have been part of one of the very good document that will come out from the Ministry of Ayush, called as the Dietary and the Lifestyle Advocacy in Mental Health, where each and every diseases, what are the different prescription that we give as the lifestyle advisors, common do's and don'ts in terms of diet, lifestyle, has been beautifully collated and being one of the very highly recommended publication from CCRS, where I was the chief editor of this particular document. And we get a lot of good, I'll again share the information in the chat box regarding this particular information. Especially when you're trying to treat some of the diseases, like for example, ADHD, autism, or any of the developmental disorders like cerebral palsy. We also strongly believe that we have to target on these three major component of Agni, Ojas, and the Manas. And that's what we commonly call it as the Ojas Om triangle, which stands for Agni, Ojas, and Manas, which again strongly believes in the interrelationship between the gut health as well as the brain health, with importance being given to the Ojas and its status in overall mental well-being. Thank you.
Great informations, and thank you for willing to share these informations with our viewers today. We really appreciate that, Suhasji. I'm going to ask Vaidya Jayagopal sir again on, are there any specific diet or digestive practices or habits that you recommend incorporating into daily life for improved mental health?
Sneha is what I would look at as one of the potential things to help with the mental health. So if Charaka has said snigdham ashniyat ushnam ashniyat, eat warm and eat moist or oily. So these two are a boon for the entire gut. If you look at the study that is done on MCT oils and their ability to culture and harness good bacteria is amazing. So if Charaka has said that, that means he has seen how people who consume this type of diet, which is curated with some healthy fat, and then when it is consumed warm, they had a much more pleasant minds, and then also robust bodies. So that's the first thing in across every treatment in the psycho or psychiatric disorders. Ghritam, and Dr. Suhas can correct me, he's an expert in this. So Ghrita or Ghrita Kalpanas or seem to be an upper hand. Like it may be Kalyanaka Ghritam, it may be Brahmi Ghritam, it may be Mahapeshacha Ghritam. Anything that you look at, Ghritam comes first. So there is a beautiful correlation to how gut bacteria and the gut nervous system. People are talking about gut bacteria. Nobody is talking about the enteric nervous system, which is the next step. How the gut bacteria would affect the enteric nervous system. There was a fascinating study where they looked at the nerve endings or the neurons in the gut. They could see the changes that happen in the brain that cause somewhat like Alzheimer's even 20 years before the real disease manifests. So that means the gut nervous system for us in Ayurveda, even though we don't have a direct correlation to Vata and nervous system, we see that major amount of functionalities of Vata is carried out by nervous system. So Sneha, consumption of any good amount of fat will be one of the first goals to establish, not only at an individual basis, but at a community basis, that everybody has to take this type of food, which is rich with certain types of healthy fats. Second, and the most commonly done now is the discovery of use of herbs and spices, which are included. If you look at many ethnical diets, which seem to be health pro and promoting longevity, you will see that each of these diets have set of their own spices. Like certain diets will have dill and parsley and things. So we have to encourage people to add those into their diet, which indirectly control the amount of gut bacterial diversity that is there in our gut. So there is one way of curating the gut and the gut nervous system. Another way is to harvest and prune your gut bacteria based on the spices and the food that you take. Thank you.
Wonderful. Thank you so much. Dr. Suhas, do you want to add anything to this?
I think I thoroughly agree with what Jayagopal sir has mentioned. So basically, rightly mentioned, I think if you look at the prescription that we find for mental disorders, there are two major categories of the prescription. One are the ghee-based or the ghita-based prescription, and other one is the asavarishtas, which have been mentioned, like ashwagandha sarasvarishta, balarishta, which mentions, and of course, sir has given the list of the ghita that are commonly used. So basically, the idea is that these both lipids as well as alcohol-based preparations can cross the blood-brain barrier, and they could be of much helpful for the management of various disorders. And one of the probably the greatest of the prescription that we find in treating the mental disorders in the literature is the use of the old ghee, what we commonly call as a Purana Grita. I think the Purana Grita has to be said to be one of the best prescription. In fact, we also produce a 10-year-old Grita, and this is one of the highest selling product that we use in mental disorders. There are a lot of changes that happens when a Grita is kept for more than, like, again, you have these different types of the ghee, like 1-year-old ghee, 5 years old, 10 years old. And we also did a lot of physicochemical as well as spectrophotometric analysis between what are the basic changes that happens. The major differences is in the saponification value as well as in the short chain fatty acids, and the iodine value was the major changes that you find in the ghee that is kept for a considerable period of time. And this really helps in various types of disorders. Again, we also did a very extensive study and we published this, the basic difference between the newly prepared ghee and the ghee that was kept for 1 year. And we did the extensive physicochemical analysis of this particular preparations. I think this all strongly adds to our belief that the diet definitely has a major role, and especially apart from the diet, like apart from the ghee, there are other prescription which we commonly do, like the dates, grapes, and one of the biggest is the use of the gooseberry and the ash god. I think ash god is one of the very potent antidepressants and stress adaptogenics, where you can cut the ash god into 8 to 10 pieces, take the pulp along with the seeds, crush them, and take the juice, 50 ml twice daily with sugar, candy, or honey, and do it for 6 weeks. An excellent prescription for insomnia, depression, and minor anxiety. Thank you.
This is wonderful. So much of great information. I feel like we are not doing justice for the topic today. It's a vast topic, and I would love to connect with you all to have like an individual session on each of these. Though we are having like a different points under the umbrella of mental health today. Thank you so much, Dr. Suhas. And Nimisha, can you please provide a few tips for incorporating mindfulness into mealtime? This is something I really want to bring this up because I really see this, including in my kids, right? That mindfulness into mealtime we all had in our childhood. How to bring this into today's generation is a big challenge. And what is its importance? I would definitely want you to, put insight to that to our viewers today, please.
Absolutely. So, we talk about stressful eating, and our whole world has just been under so much stress over the past 3 to 4 years, with the pandemic. It's led to higher rates of anxiety and depression, but also higher rates in children and adolescents. And as I mentioned to you before, that we have so many convenience foods, processed foods, and they are developed at that bliss point. So when they are consumed, there's a sense of relief, whether it be from depression, whether it be from anxiety. In our store shelves, those foods are placed at eye level, so they're easily accessible. And so in our practices, we talk about mindfulness, and helping people to pay attention to what does the food taste like, What is their experience of the food in terms of taste, texture, and temperature? And so, specifically with my population, I think in general, with people who are struggling chronically dieting, is that they have lost touch with their bodies and the signals that their bodies are sending to them, whether it be hunger signals, fullness signals. And they have relied so long on dieting, the various different types of fad diets that are out there, that they've lost touch with listening to their own bodies. And so mindfulness is a strategy to help them to become more in touch with what are the signals that my body is sending me right now. I need to eat. I'm hungry right now. Or sometimes when people are stressed, they're turning to food. Am I eating right now because my body is saying it's hungry right now? Or am I eating right now because of anxiety or depression or stress? And is my head taking over? So really educating people about the differences between, where are you feeling your body, hunger in your body when you're truly hungry, and when is it that you're looking to turn to food because of maybe anxiety or depression. Being mindful of the quality of the food that you're eating. And this is a challenge because there are, as I mentioned before, in certain areas in our communities, colorful fruits and vegetables are not always available. When we're looking at our children and teens, if they're going to school with peers who are not eating fruits and vegetables, our children and teens are wondering, well, why do we need to eat fruits and vegetables? They're learning different messages about, good nutrient dense foods from the other kids around them too. Um, there's, I'm going to bring the psychology behind all of this, So we may have families maybe sitting down and eating together, or we may have families that are not sitting down and eating together, and that influences a relationship with food. That influences the quality of nutrition that's going in. You may have parents who, are really forceful in their with their children and their teens, insisting that they must eat what they produce, or what they cook for them. They must eat according to the cultural guidelines. And so we may have negative control battles that go on between parents and their children. And in those instances, as a dietitian, as a therapist, what we're recommending to the parents is like, you're in charge of providing food and preparing foods available to the families. Have your children, have your teens involved in what their likes are, what their preferences are, but also letting them know that, there'll be sometimes there'll be food on the table that you're going to really like, and you're welcome to eat as much as you want. And there'll be some other times that it may be a food that you don't necessarily like, but there will be something to eat. Um, but to involve children and teens in the menu planning process, in the meal preparation process, but also in the purchasing process too. And so even though I don't see children in my practice, I'm working with a lot of parents. I'm helping them to develop a healthier parenting style around food and eating so that what they're learning is also being passed down to their children. So all of this really valuable information about Ayurvedic nutrition, if parents are learning about it, but then integrating it and showing their children how it can affect them positively, as opposed to sometimes the unfortunate forcing of the information, might have their children, their teens buy into this really important information that really supports brain health, but overall body health as well. So I guess that was a really long-winded answer there, Deepa. I hope that answered it. But I'm really looking at parents helping their families to develop more of a positive relationship with food and eating, as well as eating nutrient-dense foods.
Wonderful. Thank you, Nimisha. My next question is going to be on what's the role of lifestyle in mental health, whether it can be related to sleep, stress. There are so many factors that are involved. I would like to ask Dr. Suhasji on how does Ayurveda view importance of sleep for mental health, and what are the strategies does it offer for promoting restful sleep?
I think sleep is one of the most important factor for mental health. I think probably one of the biggest questions that you can always ask a patient and check his mental status is about the quality of sleep. Probably this really connects and tells the importance how sleep could be of very much important. And same thing, and probably that's the reason why under Trayopastambha, Ahara, Nidra, and Brahmacharya, we find Nidra or the sleep as one of the major factors. And this really, it's like, no, you get recharged, just like as a mobile, you would like to get charged whenever there is no charge. Probably sleep is the best way that you get really charge, repair your body, rejuvenate, and get ready for the next day's task. Probably it's a great way of getting relaxed. And that's what even in Charaka we get that Nidra etam sukham dukham pushti kasha balabalam prishata klibata jnanam ajnanam jivitam nacha. Okay, you get all the best of the benefits when you get a good sleep. So there are various, as I said, there are dietary prescriptions like you have milk products, and especially the buffalo's milk has to be one of the best because it is heavy to digest and guru in nature. Among all the milk, the buffalo's milk is said to be the best to induce good sleep. There are some very good practices like the foot massage or head massage or body massage, which can be of great help, and especially the importance of the foot massage in getting good sleep has been highlighted. And apart from this, I think we are not just dependent on medicines because there are a lot of medicines which can induce good sleep. But apart from this, I think there are some therapies like Shirodhara, Shirobasti, Shirophyanga, Shiropichu, using like Shirabala Tela, Grami Tela, Tunga Drumadi Tela, which can be of great help in patients suffering with insomnia or any of the sleep related disorders. Apart from this, I strongly believe in the helping the patients to give them sleep hygiene. Just as we have food hygiene, there is something called a sleep hygiene, which talks about the common do's and don'ts to induce good sleep. Okay, like for example, getting exposure, too much of exposure to screen before going to sleep, too much of having the food very late at the night, inducing a lot of carbonated food, drinks, energy drinks in the food. This can really disturb your sleep. And so that's the reason why we should always, because there are a lot of circadian rhythm and biological rhythm that talks about in getting a good sleep. And that is where probably, maintaining a good time for the sleep is equally important. And as far as possible, try to follow some of the activities that can be mentioned to induce good sleep. Of course, there are various medicines which have been mentioned, like for example, the Sarpagandhavati, Jatamamsi, Ashwagandha, Brahmi, which are very good to induce good sleep. But personally, I take them as a last resort until unless you can manage with the diet and lifestyle. And most of the reason, probably the reason to all of this gets connected with the stress factors. And stress is probably the major reason. And the simplest way of defining stress is when you have increased demands and you have reduced resources. And there are only two ways you can manage the stress is to reduce your demands and increase your resources. Thank you.
Beautifully said. Thank you. Thank you. Dr. Jaigopal sir, can you explain few techniques or remedies that are effective for managing stress and anxiety? Because we are talking about that now. Dr. Jai sir?
I muted myself. There was some noise outside. So the most, the convenient way of practicing here, the conditions being given, the best way to reduce stress will be to approach it from a lifestyle or external point of view rather than giving internal, supplements or herbs or something like that. Absolutely, sleep hygiene is one of the most important things to be addressed for sleep. And for when somebody comes to my practice, when we identify that there is significant amount of demands and less resources, so we will look at, let's see what can we do to bring that attention when people start their night routine? It becomes their personal time. All the day goes by without their personal time, and that's when they want time to do things that they like. So let's say somebody goes to have dinner at 8 or 8:30. From 8:30 to 11 o'clock, they're basically dedicating time for themselves, right? So I make them identify that you're taking out time for yourself when you have to be resting, right? So the resting is also a part of your recharge. Resting is part of your personal time. And then I give them a tip that, say, healthy sleep is anti-aging, so everybody registers for that. So if I say it is anti-aging, then everybody is like, okay, I've got to good on it. So second part of stress management is simple things like self abhyanga, or a walk in between. I'll find a time. I'll ask them, when is the time that you can dedicate 20 minutes for me? Then they will say, I can dedicate maybe after my lunch, I have a few minutes. So I want you to walk at that time. Because sleeping is also an issue, because we have become a civilization of sitting, right? Thanks to pandemic, we just sit. And then all our blood flow goes to the brain, not to our extremities. So I find a time for people to see how they can move. If they are interested, I'll ask them, as a child or as a high school goer, what was your favorite game or something? Then I'll pick up, okay, if you can do swimming. Yes, I want you to do swimming for 20 minutes every day. Can you do that? So I pick up these so that their stress is somewhat channeled through physical movement. Then I also bring them to talk about affirmations. Every night we say an affirmation for themselves, because these are the activities people know to do, but as practitioners, we want to enforce it, right? And then they think, oh, there's a value in it. Otherwise, it is there, but they don't imply it, or they don't implement it. So stress management through herbs is also possible. Stress management through yoga, highly motivating for people to do yoga. They see the change, so we put them through certain yoga practices and breathing practices. Because in Ayurveda, we believe that mind can be controlled by prana. Prana comes from two sources: food and breath. So if you can control these two, the mind automatically becomes more mindful and controllable. That is, swasya nigraha, means self-control increases with these activities. Thank you.
Excellent. We are running out of time, but I have so many points to cover for our audience. Quickly, let's talk about emotional well-being. Nimisha, can you educate us? How do you define emotional health, and what role does it play in overall mental well-being?
I think I just kind of briefly described it before, but when I think about emotional health, I'm thinking about how people are interpreting their interactions with the people around them, with the world around them, with the events around them, and how those experiences are being influenced also by their genetics, how they interact with them, but then how they behave afterwards. Like, what are their emotional reactions to people around them? What are their behavioral reactions to people around them? And they can be positive, and it helps them to function on a day-to-day basis, or they could have been very traumatic, very negative, and so their reactions, their emotional reactions, their behavioral reactions may tend to be negative towards others or negative towards themselves. Or, we talked about anxiety and depression, right? You'd have people who are constantly in a state of anxiety because they're anticipating, or there are people who are in a constant state of depression because they're feeling so helpless and hopeless. And we found that in this pandemic, people were very isolated, and their emotional health was really impacted. They didn't know how long it was going to last. They didn't know if it was going to affect them, if they were going to die. It impacted people on many different levels. But I also believe that the genetics also may have helped them to cope. better for some people, and maybe genetics didn't help other people to cope better for other people. And so we've had a number of people who've really come out of the pandemic with good coping skills, managing the world around them, being able to continue with how they function, and other people who are still struggling with that anxiety and depression and isolating themselves. And it's a challenge to help them to come and have a lifestyle where now they are interacting with more people outside.
Thank you. Thank you. Dr. Jayagopal sir, how Ayurveda considers seasonal changes and its impact on mental health? How important it is to really follow the seasonal regimen?
As our emotions reflect the seasons, seasons reflect our emotions. So, so definitely the stress upon the Rutucharya. There was a fascinating study that Dr. Thangavelu recently presented in the conference in California. He showed that they have traced the amount of gut bacteria in different seasons. And then you can see how they proliferate in the middle of summer and winter seasons, and they become very narrowed or minimal in the Rutu Sandhis, which is Vasanta Rutu and then the Grish. So in these two, like what we call as summer solstice and winter solstice, we have the least number of gut bacteria, which is somewhat proves what Ayurveda has been saying. This Rutu Sandhi, Rutu Kala, you need to do your Panchakarma, you need to do a specific type of diet, etc., which is just reaffirming what Ayurveda has been, upholding for a long time. So Rutucharya in the recent times, even back in India, also here, people are more open to doing some kind of, either diet changes, like it can be a mono diet, which is just khichdi diet. In the US, it has become quite famous. People just eat khichdi. And believe it or not, even that mono diet can bring a significant change in their mental state, physical well-being, and also their sensory attachments change. So this is something that has to open our eyes, saying that we thought we have to bring in some extra ordinary detox procedures like panchakarma and all that. It's not necessary. If we just do something very consistently, and then encourage this client or patient to do it with a guided fashion, what is correct and what is not correct, and give those guidelines to them, I think it's very achievable that these seasonal regimens that have been recommended in Ayurveda can be a boon for like our population to know how to prevent diseases, and then how that you cleanse your gut, you cleanse your lymphatic system, and in turn that will reflect onto a mental well-being.
Thank you so much for that. Next question I would like to ask for Vaidya Suhas. Can you please let us know what are some of the non-pharmacological methods that are effective in mental health conditions? And is there any research updates on this?
I think when we talk about the treatment, Ayurveda believes in three major modalities of treatment. You have the Yuktiyopasha Chikitsa, Daivapasha Chikitsa, and the Sattvaja Chikitsa. And the whole classification of three modalities are based on it is whether you would like to focus the physical health or mental health, whether you're able to have the understanding of different types of the causes, whether you're able to identify the basic parameters like Agni, Dhatu, Sotas, etc. And based on that, you try to use these modalities. Like, for example, if you're able to identify those doshas, you're able to identify the cause, you can always use Viktiyopasha Chikitsa. And that is more of a dosha pratinika chikitsa. But if you're not able to identify the cause, you're not able to identify the specific doshic patterns, Agni patterns, Sotas patterns, you're not able to establish the cause and effect phenomena, you're not able to identify the Karyakarana Siddhanta, probably that's the time when you have to apply the Viktiyopasha Chikitsa. And Sattvaja Chikitsa is an entire modalities of treatment that we try to follow as a non-pharmacological treatment, which is the psychotherapy or different types of counseling that we are talking about. And we have done a very nice mini review of the entire understanding, and I have posted that particular article. Is the review of the Satyology Kids and Ayurveda, a mini review and the research updates. Like how do you apply the psychotherapies in the very common psychological disorders like depression, anxiety, insomnia, mild to moderate bipolar disorders, etc. So these have been summarized, and it's a very intense and very comprehensive article that we have published. And recently, also during the COVID, also we did a very nice study where we tried to see the effect of Brahmi on depression, anxiety, and stress. And it was again recently published in the European Journal of Integrative Medicine of how, and it was a very large study that we took up of around more than 2,000 population, and then we made into different methodologies, and then we gave around 210 patients of this Brahmi for 30 days, and we could see significant reduction in there, and we used a DAS 21 scale for the assessment of these patients, and we could see that along with these medications, the diet, lifestyle, as well as the psychological interventions were said to be very, very beneficial, because it is not just, no, we cannot just have the medical model or just the, some medicines to be given in psychiatric condition until unless we try to address all the comprehensive, like mm, diet, lifestyle, and every. I think probably this is a best model. Mental health management could be the best model for integrative medicine.
Wonderful. Thanks for sharing such an useful information. I can see how parallelly you are posting all the informations in the chat. We really appreciate that. Nimisha Patel, I want to ask you, are there any precautions or considerations individuals should keep in mind when integrating any health care? Are there any challenges and limitations, and how are these addressed?
Well, when I think about healthcare, we're really looking for it to be meaningful and long term, right? We all have really good ideas, very good approaches, but we also have to look at the individual, their circumstances, their environment, and we're looking for something, creating something for them that meets their healthcare needs, but is also feasible for them on a long-term basis. And I think that that tends to be one of the main challenges, right? Um, there's just so much information that I feel like I'm learning today. So I thank you so much. And it's really important to be able to see how we can translate that information to people at all different socioeconomic levels so that they can really get benefit out of it, right? But also so important to make sure that we have physicians who are being trained to be open-minded about this. And that has also been one of my challenges, is that even learning as a functional nutrition practitioner, that if we're looking at alternatives and looking at different ways of helping people to heal themselves, sometimes there's not necessarily that open-minded to that. And I think that's one of the challenges too. So I think addressing certainly certain people's circumstances and how we can really make this information meaningful for them, but also how do we educate, and I think my two esteemed colleagues are already doing that in California, is educating all these different professionals to really start integrating this valuable information into their practices. And that in the future that we're hopefully looking at a very totally different integrated medical model. But in the meanwhile, it's like the challenge is how do we get people, medical professionals, to open up their minds. But the other thing is that with individuals, people are just so very busy. They've got a lot of things going on in their lives. And so I know sometimes the resistance that I experience is I've got too much going on in my life. I don't have the time to set this up or to buy this particular food or to buy this particular supplement. So there's a part of them that's really invested in wanting to get better, but they don't necessarily know how they're going to be able to make time for that in their lives. Sleep hygiene routine, we talked about that recently, and people really want to do that. But then they may be working 2 or 3 different jobs. And it's difficult to maintain a sleep hygiene with two of that. And so our perspective then becomes like, how do we look at all aspects of our society and how they're living, and how can they realistically, practically integrate these concepts into their daily living? I think that tends to be a challenge.
Agree, totally agree. Thank you so much for sharing that. Think we are having a great discussion. Looking at the time, we need to wrap it up pretty soon. Before that, we have a couple of questions from our chat. I would like to address them, at least few of them. First, I would like to go with Dr. Jayagopal sir. Can you please share the importance of Sattva, Raja, and Tamoguna in mental health? You're on mute, sir. Jay, sir, you are on mute. Thank you.
The uniqueness of Ayurvedic mental approach is we classify food into sattva, rajas, and tamasic food. It starts from what we intake, and then from there it'll go towards how the person's patterns or their sensory coordination and sensory perception and sensory input changes according to the diet that they have consumed. I think to get to that level of nutrition is in next 50 years people will realize, okay, these are the foods that can make a person have restless sleep or etc. So giving that as a background, the sattva, rajas, and tamas is a very broad concept, simplified, but very hard to apply or to use in clinical practice. That's what I find. Because when you try to explain to a person, okay, you're having this anxiety because you're in a state of rajas, to convert that rajas into a state of mind where the thought processes have rapidly increased in a limited amount of time, where the intellect is not working with the thought process, is a very higher concept to assimilate by anyone who is not used to the Indian culture or Ayurvedic way of upbringing. It becomes a concept that is too remote for them to even accept. So instead, maybe there is a way that we can say in Ayurveda, we have 3 compartments of mind. One is this compartment, another one. So you want to be in this compartment where your mind is more focused on things that are productive, constructive to not only your mind, but also for your body. So that's what I would orient people towards, rather than bringing them to this concept of Sattva, Rajas, and Tamas.
Wonderful, sir. Thank you so much. One last question for Dr. Suhas. Can you please let us know if there is any relationship between planetary movements to mental health? Any reference of the same in Ayurveda? Please let us know. Thank you.
I think one of the greatest development in recent years in India is the development of the integrative medicine in NIMHANS, which is one of the premier national institute in India, which is the National Institute of Mental Health and Neurosciences, where they have started the integrative medicine department, especially the integrative psychiatry as a model. So we have 3 set of doctors. We have modern doctors, Ayurveda and yoga professors who are there and trying to handle them as an integrative model. I think this have just started, and then once we generate some good data, I think this could be really a good model for mental health. There are 3 basic types of causes of diseases that Ayurveda talks about. One is abnormal usage of sense organs. The second is the prajna parada. And third, which really just correlate with the planetary involvement, is the parinama or the kala. So there, the kala refers to both season as well as the time. And we are very oftenly we come across that there is a strong relationship between the lunar movements as well as the mental health. And again, Ayurveda talks Chandra as Adipati of Manas, which talks the relationship between the moon, the movements, and you also see that the patients suffering during the full moon day and new moon day are really increasing when they are suffering with some mental disorder like epilepsy or schizophrenia or even ADHD. So there's a significant increase. So which strongly, and probably these are important things to take some preventive care. It's like a premenopausal or premenstrual, or even such things where you're probably trying to know that probably this you're going to have some because there's so much of changes that happens in the environment during this particular period, and the same thing happens because we are also majority made up of water, and there's a huge influence between the planetary movements, and very often you can see the changes in the mindset. So probably you can make some preventive strategies to manage such conditions.
Thank you, Dr. Suhas. I would love to go more about this, but I think we already passed.
So we can have part two.
Definitely. I was going, I was about to say that, it will be my sincere request to all my panelists. We have had such an enriching conversation today. We would love to collaborate with you going forward to go into much detailed discussion going forward. I would appreciate if you can, be with us, be with ARP always.
Absolutely.
Thank you so much for all our esteemed panelists for being here and spending your valuable time, giving your perspective. Such a wonderful discussion. I'm sure our viewers enjoyed today's session. I would like to request our Vice President of ARP, Dr. Meenakshi, to give a vote of thanks. Over to you.
Thank you so much, Dr. Deepa. It was such a valuable and insightful discussion with all the links by Dr. Suhas Shetty. I'm sure that our entire audience are beaming with the knowledge and they want to learn more about how Ayurveda and the integrative practice can help in the well-being of the community when it comes to the mental health. And on behalf of ARP, as a ARP Vice President, I look forward to more community collaboration and more discussions on our platform with all of you. And I also want to encourage to our attendees to consider joining ARP. The link has been posted in the chat box. But if you'd like to know more about ARP, our website is arpusa.com. You can join the membership complimentary for 1 year. As of now, for that, you can fill out the Google form. The link has been added to this. And we look forward to seeing you in the ARP community. Thank you so much.
Thank you. Namaste.
Thank you, everyone. Have a great day. Namaste.
Namaste.
Thank you. Thank you, everyone. Good job, Deepa. Good job, Meenakshi. Finally, nice to see success of our Sambhashna today. Thank you very much.
Absolutely. It's such a pleasure, conversation with having a conversation with all the elite group of people.
Yes, absolutely. Thank you.
Dr. Meenakshi, do you want to stop the live stream?